Dr. Mhinga, lovely to have you with us this afternoon. Now, when we talk about COVID-19, what we are told is that the first point of call is to stay at home, to self-quarantine, and to self-isolate. But this can also be a very stressful time for those who find themselves at home. But what are some of the things that people can do while self-isolating just to relieve the stress levels?
Look, we must understand that this is new to all of us. It's something that we have never done as people, and whether it's here in South Africa or anywhere in the world, we learn as we go. So there's no one who will tell you that it's a specialist in quarantining or in isolation. But I mean, let's look at the reason for isolation, obviously, it's because if you test positive and there's a fear that you may infect other people, so it's always better to be on your own or with the people who are also of your group, that is those people who are also infected, but under some kind of a controlled environment, So when you're at home, I mean, look, I'm sure most people will tell us, I'm sure you've got a psychologist here to tell us more. When you're at home, the first few days are easy, I am told. Very easy, you have to, if both of you are positive, of course you still have to continue with, maintaining this distance. You have to continue with sanitization. You have to continue with the masking. So the same principles that you apply under normal conditions, you still have to apply them on the isolation, because there's a chance that you can, bacteria, organisms are very funny. You may find that I've got subtype 1, you have subtype 2, so I can reinfect you. When we are together in isolation, we can still infect one another. And that the same thing happens as well with HIV and some of the organisms. So it is important to maintain that distance. You have to use your own utensils, and those who've got enough space in their houses, they don't share a room per se. One has to sleep in the other bedroom so that you don't come very close to one another for a long time, just to prevent cross or reinfection.
That's a very interesting point, that just because you both have COVID-19 doesn't mean that you don't maintain social distance, because there are different types and you could reinfect each other. But what are some of the things that could prevent a patient from healing while at home?
That would prevent a patient from?
From healing and getting better.
Yes, of course. If you expose yourself, and obviously we try to discourage many people from taking alcohol. Yeah. So you have to be very, very conscious of the things that you do. You cannot take. We advise you not to take alcohol, obviously, for obvious reasons, because that can actually complicate the picture. And make sure that you eat things that are healthy. I know I'm saying this is an ideal situation, but of course, in our situation, sometimes it's not that easy to have the so-called a balanced. It's not that easy to have what we call a balanced diet. But whatever you do, make sure that you eat things that can at least build your body over that period of time, 14 days to 21 days, depending. So you have to eat things that are not going to destroy your body. Avoid smoking, avoid drinking, and you have to exercise. And one of the things that is very important, if we are here in South Africa or in Africa, we've got enough sunshine. So please spend some time outside, walk around in your yard if you've got enough yards and space, walk around and do some bit of exercise, because that is very important for you. And particularly for those who are slightly on the other side of the age, to move around is very important, because you must understand the COVID infection, the biggest problem, it's in the clotting. You get what we call inflammation of the blood vessels, and that can easily lead into blood clotting. So if you're going to be sitting at one place, or if you're going to spend most of your time sleeping, that can make the clotting, that will promote what we call clotting of the blood, and that will actually complicate the picture. So to move around, do something in your garden, do something in your house, some kind of a manual work that will keep you moving in that restricted space, just to avoid the complications of clotting. And if you can beat that, the better. With the sunshine, of course, we do that because vitamin D or vitamin D3 is very important to try and balance your, to prevent clotting. So it is important that you have that. And we tend to think that because we are black people, we don't need too much of the sunshine. It's a mistake. Any one of us, and in fact, those who are of a lighter or a fairer skin, they tend to absorb health of sunshine better than us. So you still have to stay in that sunshine. If you can't, then you have to get supplements to try and make sure that the amount of vitamin D that you have is sufficient. And of course, we have another element of zinc and selenium. Those are the things that are recommended, and many people are using that, and they don't necessarily have to end up in a hospital as a part of something that will fortify your body.
Some really great advice there, Dr. Mhinga. Thank you so much for that. A little bit of sunshine will go a long way.